Hello, I am Dr. Mark Stickney, and welcome to Ask the Vet Live with us here at Spay Neuter Network. I am so happy that all of you were able to join us today, and we have a lot of questions from folks that we are going to answer over the next 30 minutes, plus any questions that y'all send in to us live while we are going along on the air here. I would like to start, before we get into any questions, to let everyone know that here in the month of May is an event called North Texas Gives to Animals. And this is an event where you can make donations directly to Spain Network. It begins on May 14, which is tomorrow. And right now, whatever amount of money that you were to donate to us, it will be matched. And so, whatever your gift is, it will be doubled and will go twice as far to help pets in need. We depend so much on the generosity of people like you that help us to accomplish our mission of taking care of pets, maintaining their health and wellness, and by doing that, making sure that people have a wonderful relationship and bond with their animals. So, if you are able to make any kind of a gift or a donation with North Texas Gives to Animals, that would just be fantastic. And right now, if you starting tomorrow, if you do that, it will be matched. It'll go twice as far to help everybody. So keep that in mind if you are able to. May is also National Pet Month. So that is something that's near and dear to all of us because we all have pets, and you're here because you have a pet. And so this is a month to appreciate having pets and the things that they bring to us in our lives. They bring us so much joy. They're good for our health. Petting an animal has been shown in study after study to reduce your blood pressure and stress hormones in your body, and they just provide so much enrichment for us. So they are wonderful, wonderful additions to our family. So speaking of pets, let's go ahead and take a look at some questions that were sent in prior to the event here starting. And then if we have questions that come in live, we'll pause and take those as we go along. So John writes in to say, my 6-year-old Yorkie had a large tick on him this morning. We are getting ready to remove it with tweezers, but before we could, the tick fell off on its own. We're not sure if the whole tick came out or if part of it, like the head, may still be stuck in the skin. Our vet doesn't have an appointment available until next Thursday, and other clinics we called don't take walk ins. Is this something that needs urgent care, or can we monitor him at home? What signs should we watch for, and when should we be concerned? All right, so all great questions. The weather is heating up, and fleas and ticks are a major, major problem right now, and it's only going to get worse as we go through spring and into summer. So I'm going to go ahead and say it right now that all of your pets should be on some kind of flea and tick prevention. You don't want them bringing fleas into the house. You don't want them bringing ticks into the house. Both of those little parasites can also bite and chew on us, and they all spread diseases. So we'd like to keep that to a minimum. And remember, you can say that your dog or your cat doesn't have fleas, but the neighbor's pet does, and the fleas don't care about a fence. So your pet's going to be exposed to them. So you want to make sure they're on some kind of a prevention. Now, having said that, if the tick fell off on its own, the head came with it. You don't have to worry about the tick's head being stuck under your dog's skin. They don't abandon parts of their bodies when they let go on their own. So you are in good shape there. Now, if you are going to remove a tick, you want to make sure that you grasp it with some kind of tweezers or little instrument right where its head connects to the skin, and that's where you want to grip it to pull it out. And if you do that, you are very, very unlikely to leave any of the tick behind. let's say, so this is not an urgent matter. This is certainly something that you can monitor at home. What you'd be looking for if a tick's head did get left behind under your skin would be a little local bump, a little local area of infection. It is likely that the pet's body would take care of that itself and wall it off and spit it out, and it look kind of like they had like a little pustule or a big pimple for a little bit, and then that would rupture and go away. But if you did see that, getting that checked out by your veterinarian and getting started on some antibiotics would probably be a good way to go as well. So, so you're in good shape here with your little Yorkie. Make sure that we're on flea and tick prevention, and we should be all good there. Okay, Maria has written in to say, I adopted a 2 month old kitten named Loki a couple of days ago. And with a name like Loki, I have a feeling I know where this question is going. So let's see. At this age, should I schedule his kitten vaccines, rabies shot, and deworming as soon as possible, or there a certain age I should wait for? Also, do you have any general tips for first time kitten owners on keeping a young kitten healthy and safe? Okay, so little Loki is sounds like a very lucky kitten. You are a concerned pet owner. You want to make sure that you're doing everything right for Loki. So that is great. So as regarding the vaccines, we can start giving kittens their vaccines as early as 5 weeks of age. So we are 2 months, so we're 8 weeks old. So definitely a great time to start getting vaccines. Vaccines are a incredibly useful and safe thing to do for our pets that reduce that help reduce and in some cases eliminate the risk of a lot of very common diseases that are easily spread from cat to cat. So, absolutely, it is time to get his vaccines. The rabies shot, you'll have to wait until he is 3 months old to get the rabies shot, but we can start his other vaccines now, and we will boost those typically every 2 to 4 weeks. Rabies shots at 3 months of age. That's by Texas law. That is the earliest that they can get that vaccine for it to count as a legal rabies vaccine. So we'll do that, and then getting them dewormed now when we get our first round of vaccines, and then also every time they go in to get their booster vaccines as a kitten, we will want to deworm them again because kittens are and puppies are very good at getting themselves reinfected with GI parasites, and they can pick those up on the ground whenever their little noses are on the ground. So getting them dewormed frequently is also a great thing to do. So we're good to start doing all of those things right now. Now, general tips for first time kitten owners on keeping a young kitten healthy and safe. So, number one is wait until we are through with our vaccine series before we expose them to other cats. We want them to have a competent immune system that is ready to fight off any potential bacterial or viral infections they might encounter from another cat. So, that will be step one. Step two, we'll want to get this little kitty spayed or neutered as soon as possible. If Loki's a little boy kitty, then the sooner we get him neutered, we don't have to worry about him developing a lot of nuisance male behaviors like trying to mark his territory in your house with his cat pee. And that smells bad, and once they start doing that, they can develop that into a habit and keep doing it. So we want to nip that in the bud. If this is a kitten, if little Loki is a female, we're going to want her to get spayed before she goes into her first heat cycle around 6 months of age. We want to get her spayed so that she doesn't start driving you crazy at home, caterwauling and looking out the window and trying to escape every time you open the door to try to find a boy cat. So getting those things done as soon as possible will also be a very good thing, and we can spay and neuter kittens as early as 2 months of age and 2 pounds. So we're right on track with that with this particular cat. Other things that you'll want to do is make sure that your home is kind of kitten proof. A little kitten will find its way into anything. So if you have other pets, we want to make sure that they are not ever left alone together until the kitten gets a little bit bigger and we are sure about how they're going to respond to each other. We are going to want to make sure that there's nothing, no little holes or anything like that, or cabinets that are always open that the kitten can crawl into and get itself into trouble. Kittens love to play with strings and electrical cords. So let's make sure that we have those things kind of tucked away where the kitten can't get them. And we want to be aware of any sort of strings, little ropes, yarn, things like that that the kitten can get a hold of and maybe possibly eat, because that can be a major uh, an emergency surgery if they do something like that. We want to get them started off on the right foot as far as litter boxes go. So the general rule is that you want to have one more litter box than you have cats. So if Loki is the only cat you want to have two litter boxes in the house, usually in different areas of the house. It is important right now that the litter box has a low enough opening that little Loki can jump in there without any trouble and use the litter. Whatever litter you start using now for Loki is going to be the one that he will tend to prefer for the rest of his life. So choose wisely. Choose one that's easy for you to have and to get, and that you like as well, because that's what he's going to get used to liking. And then also at this age, we want to get him started on a good, high quality kitten diet. So, he's a little kitten. He's not going to be like any kind of a racing performance cat or anything like that. So, as long as we are feeding him a balanced diet from the grocery store, a balanced kitten diet, that is fantastic. And we will want him to eat that kitten diet until he's a year of age, and then we'll transition him over to an adult diet. Right now, Loki is a little growing eating machine, so you can pretty much leave food out for him all the time, and he can eat and nibble as he wants to. But as he starts to get a little bit older, we're going to want to monitor how much he's eating and control how much he eats, because we don't want him to start to gain weight. Weight gain in pets is as not good for pets as it's not good for us. So once you have those pounds on, like me, it's hard to get them off. So we will want to, as Loki gets bigger, adjust our food, and you can consult your veterinarian for advice on that as Loki gets a little bit older. Sounds like you're off to a great start and you're asking really good questions. So well done there. Okay. Ashley has written in to say, I've been caring for a 9-month-old stray cat since she was born, and she recently broke her leg badly enough to need surgery with a plate and screws. Her vet said she needs crate rest for at least a month so her bones can heal properly. She's still young, energetic, and very vocal, so I'm worried she'll have a hard time being confined. What can I do to make crate rest more comfortable for her, keep her calm, and help her recover safely? So, this is a fantastic question, and I think you've asked great questions. How are we going to keep her calm? How are we going to keep her comfortable? And how are we going to keep her safe while she is recovering? So, the first thing that I will say is that when we talk about crate confining a pet after a major surgery, a lot of people will kind of immediately go to, this is going to be so hard. They're not going to be happy. This doesn't seem right. Well, here's the thing. If we have a major surgery and get our leg pinned, they're going to tell us to stay in bed and stay off of it, and we can listen to that and hear that and do that, right? The cat or a dog cannot. They want to just keep acting like cats and dogs. The leg is fixed. They feel great. They don't know that they need to rest, but they have to. And we are doing them the best favor we can by keeping them restricted while that bone heals. The worst thing we want them to do is to go crazy and injure that leg again, break the plate or break the pin, because now we're right back in a worse place where we started, and we're looking at doing that same surgery again. And this time it's like, why didn't I just do this the way I was told in the first place, right? When we look at the entire lifespan of this kitty, a month in a crate is a drop in a bucket. So keeping them crate confined is absolutely the way to go. So what are we going to do? We want to have enough room in the crate for the cat to be able to stand up and stretch and move around in that crate comfortably, but we don't want them to be able to, go zooming around anywhere. The crate needs to have enough room for there to be a little litter pan that they're going to use, and enough room at the opposite end for them to have a little food and a water bowl, something that is not easy to knock over. We'll want her to be comfortable with some blankets and towels or whatever she likes to have in there. And then your veterinarian should be able to prescribe some sedatives for your kitty so that they just chill out and relax. And I know that's easy for me to say because I'm not the one with the cat confined to a crate, right? But it will definitely help and make a difference. Another thing that you can do is that there are some products that you can pick up at the pet store that are feline feel good hormones, pheromones. One of the products is called Feel Away, and you can spray that on one of the blankets or one of the towels in that crate. And this is a pheromone that mama cat secretes when she has little kittens. So when an older cat smells those pheromones, you can't smell it, but they can. And when they smell that, they just like relax and say, "Oh, this is good. This is just like when I was a little kitten being protected by mama," and that will help them relax as well. We can give them a few little toys to play with in there. Nothing that they're going to want to jump around and chase. Like you don't want one of those little sticks that has the little fluffy thing on it to try to encourage them to run around or anything. But we can give them some little things to play with. We can also think about putting the crate near a window if possible, so that they can look out the window and see what's going on and get a little bit of enrichment that way. You can certainly bring your cat out and pet it and brush it, and as long as you're holding it in your lap and not letting it get away. But then it needs to be back in the crate most of the time, so that that leg knits together. This is a young cat. Assuming this fracture was not complicated in any way, we should heal up really fast. So those are some things that you can do. Okay, Jessica writes in to say, I recently took my vet to my I recently took my dog to the vet to have her knees checked, and while we were there, she also received her rabies and parvo vaccines. Since then, she has been vomiting and having diarrhea on and off. I'm worried it could be a reaction to the vaccines or that she may have picked something up while we were at the clinic around other sick pets. How can owners tell the difference between normal vaccine side effects and symptoms that need veterinary attention? At what point should vomiting or diarrhea after vaccines be treated as urgent? Okay, great question. So, vaccines are one of the best things we can do to help protect our pets and keep them safe from getting sick. That being said, sometimes pets will have a reaction to that vaccine. We are stimulating their immune system, and sometimes their immune system kind of gets overactive and they can develop vaccine reactions. Typically, if a dog is going to have a vaccine reaction, it is going to happen within a few minutes to hours of the vaccine, sometimes as long as 24 to 48 hours out, but that's pretty unusual. It's usually going to happen pretty fast. Things that can happen when we see a vaccine reaction. We can have local reactions, which are kind of exactly what you would expect when you get a shot of something underneath your skin that's supposed to stimulate your immune system. That area can get swollen and red. You can feel a little bump there for a few days, and our pets can be kind of sleepy after the vaccine. That's all nothing to worry about. That will all resolve on its own. The things that indicate a more serious vaccine reaction is if they start to their head and their ears start to swell up, and that's usually going to happen within minutes to hours after a vaccine reaction, and that indicates that they need to have some anti-inflammatories given to slow down that immune response a little bit. So that's going to be another common thing to occur. More serious side effects include something that's called anaphylaxis, and this is a life-threatening vaccine reaction where dogs will collapse and they'll go into shock. They may have some vomiting and diarrhea, but they need to be seen right away. That is an emergency, and they need to be seen right away. So, if your pet started vomiting and having diarrhea a day or two after the vaccine, and it has persisted over a period of time, it's probably not vaccine related. Now, could they have been exposed to something from a sick pet at the vet? Possibly. But they're also dogs and they go outside and they're exposed to lots of things as well. So, that people get little GI bugs and dogs get those too. So it could be something totally not related. But if I have a dog that is vomiting irretractably, just vomiting over and over the course of 12 to 24 hours, vomiting more than once an hour, that is an emergency. If we are having diarrhea to the point where the dog can like not be in the house because their diarrhea is so frequent, that is going to be something that we want to see our vet for right away. Um, but but vomiting and diarrhea are a very unusual side effect of vaccine reactions and occur only in more serious cases of that. So if your pet is doing fine otherwise, this sounds like something that is not related to the vaccine, and that if it's still persisting, if it's been going on for longer than 4 or 5 days, probably should see your veterinarian about it. But it sounds like we will be okay. All right. Lauren writes in to say, I'm worried my two dogs may have gotten into a bottle of Nesquik chocolate syrup. One is a 50-pound puppy, and the other is a 15-pound older dog. I'm not sure how much they may have eaten because the bottle had a puncture near the bottom and there was syrup on the dog bed. All right, I understand how this is going. I've been in a similar situation myself. I know chocolate syrup may not have as much chocolate as other products, but I'm still concerned. How serious is possible chocolate ingestion in dogs, and when should pet owners do? What should pet owners do if they don't know how much their dog ate? When is it something that needs an emergency vet visit? Okay, so chocolate is toxic to dogs, poisonous to dogs. We've all heard that, right? So the darker the chocolate, the more toxic it is. So a block of dark cooking chocolate is more toxic to a dog than a milk chocolate Hershey's bar. That being said, depending on the size of the dog and how much of any kind of chocolate they ate, that can create chocolate toxicity. And this is because chocolate contains caffeine and another chemical called theobromine, and dogs are not good at breaking those down the way we are. And these will translate in an animal that has a chocolate toxicity as being overactive, high blood pressure, jittery, and so it can affect their heart as well. And they can start to have heart palpitations, vomiting, diarrhea, and they can die from it. So, if you suspect that your dog has ingested chocolate, that is always something that you're going to want to go to the ER, to the emergency clinic, and get checked out. Chocolate tends Chocolate tends to be absorbed more slowly than other poisons, other toxins. We will typically see clinical signs of them showing chocolate toxicity within 2 to 12 hours after ingestion. But if you know they've eaten it, you take them into the emergency hospital, bring the bottle or the wrapper or whatever it is you know that they ate, and we're going to err on the side of assuming that they have had too much, because the sooner we can get on top of something before they have a lot of cardiovascular systemic effects, the better. So we're going to induce vomiting in them to get them to vomit up whatever is still in their stomach before it gets absorbed. They're likely to get hospitalized and will probably need some sort of support like fluid therapy, something like that, and observation overnight. Exactly what needs to happen depends on how serious their clinical signs are when they arrive. But anytime you think a pet has eaten chocolate, that is something that you want to get checked out right away. Okay. Emilio writes in to say, I have a 2 year old Yorkshire Terrier who has already had two heat cycles. Because of moving and timing, we weren't able to have her spayed when she was younger. Is 2 years too late to is 2 years old too late to spay a dog, or can it still be beneficial? I'm nervous about putting her through surgery, but I've also heard spaying can help prevent certain health issues in the future. What should pet owners consider when deciding whether to spay an adult dog, and what questions should they ask their veterinarian before surgery? Fantastic question. So, spaying a dog will always have some kind of a benefit regardless of their age. And 2 years is certainly not too old to get them spayed. So obviously, it prevents us from having an unwanted litter. Dogs that are in heat are really, really good at attracting male dogs and getting bred and then becoming pregnant and having a litter of puppies. And it can happen so fast that you don't even know what happened. And the next thing you know, you've got a litter of puppies like I did when I was a little boy, and we ended up with Schnauzer mutt puppies because we didn't have our dog spayed and we really didn't know what we were doing back then. So You can avoid that. Number two is you avoid heat cycles and having to deal with the things that come along with that. Number three, having a younger dog spayed clearly will help reduce and or eliminate their risk of getting mammary cancer, which is the most common cancer in female dogs. At the age of 2, we will probably not get a lot of benefit from that necessarily, but a common emergency problem that intact older dogs get is something called a pyometra, which is an infected uterus. And this is a life threatening emergency, can be a life threatening emergency, and will turn your spay into a $2,000 or $3,000 emergency spay if that happens. So, having your pet spayed now while we are still young and healthy and do not have any of these things going on will be a great idea and can help prevent problems in the future. So, 2 years old is not too old at all. The things that you want to ask your veterinarian are: does your dog appear healthy for surgery? How do our heart and our lungs sound? Do we have good pulses? If you're able to have blood work checked prior to surgery to check liver and kidney function and our circulating blood volume, that is a great thing to do as well. So those will be the little questions that you want to ask. All right. Ethan writes in to say, I have a wonderful cat, female, fixed, up to date on shots, no known health problems. The vet has advised me to get her teeth cleaned. She has had previous cleanings and has had a few teeth removed. My concern is her age. She'll be 15 at the end of June. Is there anything in particular that I need to ask the vet or do for my cat? Thanks. All right, so as I get a new birthday every year, I am always reminded of the fact that old age is not a disease. So if you are older, but you are otherwise healthy and don't have anything going on, then you have no more risk of anesthesia than anyone else in the general population. Now, being older does mean that some health problems become more common. So we would want to check blood work on your kitty before anesthesia, listen to that heart and lungs, make sure everything sounded good, and take a quick peek at that mouth and see if we have any. Can get a guess of exactly what we'll be getting into. We never know for sure until when you're doing a dental, until the pet is anesthetized and you're able to take a good look at those teeth. But we'll want to make sure that everything else is apparently healthy with your cat prior to doing that. After and that being said, keeping your cat's teeth healthy and gums healthy goes a long way toward your pet's overall health, how good they feel, and maintaining their other organ health. Bacteria can seed from the mouth to the kidneys and cause kidney problems, to the heart and cause heart problems. So, staying on top of that is a great idea. And as long as your cat is otherwise healthy, you should be in good shape. Okay, I have a question here that came in that says, I believe one of the feral cats around my neighborhood has rabies. I'm not sure. How can you know for sure it's rabies? What should I look out for? Okay, so rabies is nothing to fool around with. So if you suspect that the cat has rabies, you will want to call your local animal control so that they can potentially come out there and potentially catch that cat or set a trap for that cat to catch it. Um, a rabies is a fatal disease spread by bites that you don't want to fool around with. And that's why it's a law that your pet be vaccinated for rabies, and we don't want to take any risks for that. So let animal control know. The thing with rabies is that it can look like all kinds of things, but sometimes cats can act really calm for a little while that have rabies. Sometimes cats will become incredibly aggressive. Sometimes they'll do weird head twitches. Sometimes you'll see them have seizures, but regardless, none of that stuff is good. And if you suspect it and it's a feral cat, the sooner that cat can be trapped and taken care of and removed from that community, the better for everybody. All right. Coming up here, we are about out of time. Coming up here, we do have Oh, and I would also say if you think an animal has rabies, don't go anywhere near it. Don't touch it. Don't try to interact with it all. Call someone who is an expert in doing that kind of thing to take care of it for you. Keep your pets away from it. All right. I do want to say we recently had the Lone Star Bark, and thank you so much to all of our sponsors and staff and volunteers who came out to make that a fantastic event. And thank you to all of the people and all of the pets that came out to that. We do have some upcoming free and low cost vaccine clinics. Make sure you check out our webpage, spayneuternet.org, for all of the details on that, or here on our Facebook page. On May 16, this Saturday, starting at 8 a.m. at Lancaster City Park, we have free pet food, vaccines, and microchips for dogs and cats. You can find that address on our website, and so if you're in the need for your vaccines, your microchips, and some free food, sounds like a good thing to go to this Saturday. Thank you everybody for being here today and for your attention. Have a fantastic rest of the month, and we will see everybody in June. Bye bye.